Welcome everybody, another Mancoll Minute. Hope your summer's wrapping up, and if you've got college kids, hopefully they're back and it'll be a great year for them. So we continue to get lots of great questions about surgeries, what to expect during surgeries, after surgeries, realistic outcomes. But I got one recently I love talking about, and it has to do with tummy tucks. I do a lot of tummy tuck, getting ready to kind of do my third one of the week, and I tell people the operation is obviously a very important part of a tummy tuck, but to maintain all those changes I make, that flatness, that tightness, that super tight waist with the lipo-abdominoplasties I do, really the post-op time is critical. And those first probably 2 to 3 weeks are probably some of the most important in the initial healing phase. And then believe it or not, I believe that healing goes on, that you have to pay a lot of attention to well beyond the 6-week mark. And what I mean is this. A tummy tuck really addresses 3 layers: skin, fat, and fascia, the lining around muscle. Every one of them is treated as a step in the operation. But one of the critical ones that gives people that shape is the muscle layer. Now, for a lot of folks that come in, and I saw 2 consults yesterday where they said to me, I'm tired of feeling like I look pregnant. People keep asking me, when's the baby due? Because in their case, their muscles, which otherwise should be together, have been stretched out. It's not that the muscle's weak, because they can tighten it up nicely. It's the lining around the muscle called fascia. So in a tummy tuck, that fascia is being tightened up in virtually every case, and I would say every case for me. So when you tighten it, you're doing stitches, and those stitches are strong, but the tissue they're in is inherently weak, i.e. that's why they stretched out. So it's really important to not, in my opinion, strain that repair while you're trying to heal. And what that means is linear motion is fine, but when you start to put a twisting motion in, the biomechanical forces that literally tug those 2 sides that got brought together can eventually weaken. And the sutures might stretch, the holes they're in might stretch, and eventually you go from a flat belly to a less than flat belly. And if you do that enough in the course of those initial, and I believe 12 weeks, then the amount of scar the body makes to take over won't be strong enough to kind of oppose it. So one of my most important restrictions afterwards is the twisting. Second, you must walk 5,000 steps a day. Blood clots aren't very common, but they can be very dangerous. This operation has the highest risk of that of all the things we do in cosmetic surgery, even though that risk may be very low. So to minimize that, I tell people 5,000 steps a day. Track it on your watch, on your phone. I do put people on Lovenox shots. Hydration, 100 ounces a day for most people. Mostly water, 80%, then something with electrolytes. Again, dehydration is an important thing afterwards. It can increase your risk for blood clots. It can increase your risk for constipation. It can just make you lightheaded, dizzy, and feel bad. So hydration is critical. And finally, good deep breaths, 15 to 20 every hour. It's all designed to minimize pneumonia. So the key is walking, moving, breathing, not twisting. Those are all the most important things. And there's lots of little stuff that we go over in here, but if people were to ask me the most critical steps post-op, those are them. And that's how I have successful patients, by having them follow those steps. And I kind of keep close tabs on patients. We communicate post-op, ask them to send me pictures through our TouchMD app, so I can see how they're doing the next day, in addition to just a simple phone call. Our visit's at 1 week, and I'm available anytime in case there's questions or any worries. I think all those things lead to a successful outcome. So yeah, tummy tuck that day is obviously critical, but it's how you manage that really 4 to 6 weeks afterwards, and even a little bit longer for twisting, that's I think leads to the success I see for my patients. Hope that answers the question for you. Love to talk to you about it more. Have a great weekend.